Hello, I am Opoyemi, one of the co-founders of MDaaS Global. MDaaS stands for Medical Diagnostics as a Service, alongside Shoga, who has as our CEO, Genevieve and Joe. MDaaS started way back in 2016 from the city of Ibadan, and that was our first location. In that first year alone, we attended to about 50,000 patients in the city of Ibadan. To date, we've opened about 20 locations across 10 states in Nigeria. And right now we're serving about more than 500,000 patients across all our 10 locations in the country. Then MDaaS started more as a business to provide affordable healthcare to millions of Africans, starting out of Nigeria, because what we realized was a lot of Africans could not afford affordable diagnostic services, which is the first point of care in any healthcare situation. Like they have to diagnose you before they treat you. Then it was obvious a lot of Africans could not afford this. And apart from that, most medical facilities do not even have the basic equipment they need to carry this out. So we partner with doctors, with hospitals, and HMOs and so on across the country. So as part of our goal to make healthcare closer to people, affordable, as much as possible to them, we're in places where most other facilities do not want to go to. For instance, like a place like Offa, you hardly find any suitable diagnosis unit there, but we're operating there. And this actually brought healthcare closer to people, because normally people have to travel away from Offa to Lorin, which is like 1 to 2 hours away, just for basic pregnancy tests. But right now in Offa, pregnant women in Offa can easily walk into our center, pay as low as 1.5, and get their scan done. And this really helps them in getting early information about their pregnancy without having to go to the stress of 1 hour journey to Ilorin. So over the years, MDaaS has grown, and so right now we have like a tech-enabled platform that makes it easy for our patients and our partners to easily access our offerings. So we have our Only Working system built in-house. Then we have the BIM OS, which will be for our partners. So this way, people don't have to bother to come to us for their results. They can easily just log in on their platforms and view it. So presently, as I said, we do about 1 million or thereabout patients yearly. And out of these, we see almost 50% female women that we attend to across the country. Even in our HQ, our workforce has about 40% women in our employee. And presently, we have more than 100 people totally employed across our HQ to all our facilities across the country. Yeah, starting back in 2016, we had to raise money. It wasn't easy, but we came across Healthcap then, and Healthcap was one of our earliest investors back then. They supported us really well in our first raise. And from then to now, the Healthcap team has been very great and supportive to our growth. That's introducing us to business partners. They actually helped us with links to HMOs, because back then we were trying to build our HMO business, which was something we really needed at that time, because the market in Nigeria is a bit, there is the walk-ins and you have the HMOs as well, which is mostly corporate. So breaking into that market wasn't easy for us, but we approached the Healthcap team and they helped us with introduction to some of the key players in the HMO markets in Nigeria. And apart from that, they occasionally come around, check on us, see how we're doing, how we're progressing, and all that. Then the one that actually stuck out is when we wanted to open a location in Ikeja. It was quite hard for us to get a facility, so we approached the Healthcap team, and they helped us with a location, which we are still presently using in Ikeja. So the Healthcap team has been very useful to our growth. Like every now and then they come around, check on us, ask us what we need, give us necessary support, and open more businesses for us, more industry introductions, and it's been a very fruitful partnership with them right from 2016.